Hello, everyone. Welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have again Dr. Vinit Banga with us. Now he's here to discuss his branch, neurology. He's doing such amazing work in that, and hence he's here to understand about this branch. Why should you pick this branch, and why did he do that, and how he progressing in it? What is the scope? What is the future? And what all can you look forward to in this branch? Welcome, Dr. Vinith, to the platform. It's really nice to have you here again.
Thank you. Thank you so much, Dr. Aishi.
Yes. So let's again, just briefly about your journey for our new viewers. How have you, how has it gone till now?
So I guess some people might be knowing me. So I'm Dr. Vinit. I have completed my graduation, which is MBBS for a doctor from Santosh Medical College, Ghaziabad. Then I pursued my MD in internal medicine from MLB Medical College, Jhansi. Subsequently, I pursued DM in neurology from 13 to 16. And since then, I have been doing fellowships in stroke from India and abroad and doing intervention fellowships. So it's been a roller coaster ride since last 18 years or so. And now currently working as a consultant and head neurology and neurovascular intervention in Medanta, the Medicity, Rajasthan, Sriganganagar.
Wow, that's nice to know. So now, why did you pick up neurology? Neurology is a branch that people intend not to pick up at times. What was your intention to pick this up, and what did you find exciting in it?
So I don't know, like if you ask me like any particular reason that I chose it, I probably have none. So it excited me. Like I remember when it was in year 2005, I was in second year of my MBBS training, and you start having postings in clinical branches. And I was posted in medicine as my first posting. And the teacher, my faculty there, I remember his name, Dr. Ashish Sharma. He was the professor, and he used to have very active interest in diabetes and neurology. So he was teaching us a case, and he was telling us about neurology, and there were 3 Ws: what is the lesion, where is the lesion, and whether it is the lesion. So like, and he was explaining it in a way in which neurology seemed like mathematics. So it seemed like a puzzle solving to me. So the patient gives you certain history, then you have to ask certain questions, and then you reach a diagnosis. You don't need fancy equipments, you don't need fancy tests to diagnose certain things. It's just the patient and you. And 80% of the job, like all the neurologists would agree with me, 80% of the job is done by good history taking in neurology. And it was like puzzle solving. So it excited me a lot. And since then, like I've been in love with neurology. Though neurology, like whether you ask somebody who has done MBBS or MD, he'll say the neurology was the worst ever thing that ever happened to them. They never wanted to read neurology. But since that day, I have started reading neurology. And the good thing about neurology is once you start reading it, you'll start liking it. Uh, and then you'll get into it. Though it at times may seem boring because of the outcomes that patients have, but we'll discuss later probably. And that has also changed in last decade or so. So neurology is no more the dead or the cold branch that people used to talk about. It has changed a lot.
I'm sure. So that is the reason we are discussing it now. How is it changing? So when you and what in during these years, how have you seen neurology evolving? How is the scope changing in India? How have you seen it? How are the opportunities increasing in the branch?
So when I was doing MD, so like I'm talking about 2010, 11, 12, the cardiology was the most sought after branch. There was a lot of competition because of many things. Cardiology offered thrill, cardiology offered money and everything. And neurology, as you said, it was considered to be a dead branch. And then what has happened is since then, neurology has changed a lot. And there were like almost half the number of seats of super specialization in neurology. I'm talking about India when you compare it with cardiology or other specialities. So neurology since then has evolved by lots and lots. So there have been multiple subspecialties that have come. There have been new treatments, the treatment paradigms, the protocols have changed. And if you'll ask me, once I was doing MD, I was not very sure whether I'll go for neurology or not. So the only reason I did neurology, though people may find it very odd, was that I didn't want to waste my time, and cardiology was very competitive, and I hated late night calls and emergencies. So I thought, which was the other specialty, and the only specialty left was neurology. And neurology, though I liked it, so I went ahead with neurology, appeared for the exams. Though I liked rheumatology a lot, so I appeared for rheumatology as well. Unfortunately, there were only 4 seats. I couldn't clear it. And then I went into neurology, luckily for me. And since then, so now that I am practicing neurology for quite a lot of time, I think neurology is one branch that has always been underrated, probably underpaid, and under-recognized. So wherever you'll go, you'll find a lot of cardiologists, a lot of neurosurgeons, but to find good neurologists, even neurologists, and then good neurologist is a very tough task. So, and then there have been subspecialties that probably we'll discuss later that has now taken neurology to an altogether different level. Whether you consider it in a metro cities or in like tier 2 or tier 3 cities. But when we talk about like maybe a decade back, neurology was considered just a necessary evil. You need to have neurology consultant in your hospital to have references. That's it.
Correct. So now, understanding about, as you mentioned, about metros and tier 2, tier 3 towns, and what I know, you have practiced in both the places. You have practiced in Medanta and Gurgaon as well. And currently you're working in the Medicity branch of Medanta, Medicity branch of Sriganganagar. How is the difference of practicing at both the places? And, is there a need of a neurologist in a tier 2, tier 3 town is also a big question that people want to understand. So how is it different?
That's actually, it's the opposite. So like it's the brain drain actually is more towards metros. So no one wants to come to tier 2, tier 3 cities. So the requirement is more in the tier 2, tier 3 cities. I would rather say that the metros are already saturated. If I talk about Delhi NCR, where I have worked, it's already saturated. There are like many neurologists around, and there have been a lot of competition in that branch. But when you just move 50 kilometers here and there from a metros, the opportunities are great, and you kind of think that you are doing justice to your talent. So I've worked in Udaipur, I am working in Ganganagar, I have worked in Gurgaon, I've worked in Delhi. So like when you compare, like you find a lot of changes with regards to practice. But with regards to the thrill, the excitement that you get while practicing neurology, which was the reason I chose neurology in the first place as my specialty, is more in tier 2, tier 3 cities. So I'll divide it into 3 things. One, satisfaction while sitting in your OPD and practicing, which is more in tier 2, tier 3 cities, because you'll get a lot of patients that you have read about, and they might be undiagnosed maybe for 20, 25 years, maybe a decade, and then you diagnose them. It offers you instant satisfaction. Number 2, finance. Yes, financially, it's very, very lucrative to practice in tier 2, tier 3 cities, while metros offer you corporate jobs where you would be working probably 10 to 5 thing. But then the satisfaction that you want to have from that branch is more in tier 2, tier 3 cities. Now, third thing is the personal life. And then personal life is an individual take. So somebody likes it to slog it out in metro, maybe waste an hour or 2 every day while traveling, seeing sometimes hostile patients. The other person might like it easy peasy, and they don't like to travel. The pollution is less, and things are easy. And like even for tier 2, tier 3 cities, they are evolving. It's not the way it was. So like, for example, if I talk about 10 years back, these small cities were different. Now they are completely different. And all of us as individuals know that how things are changing. So I would say tier 2, 3 cities are the future, in which, as far as the medical and healthcare sector is concerned, especially for neurology, I know about cities where there are like 20 to 23 neurosurgeons, and there is only 1 or 2 neurologists. And if I talk about OPD practice, it's more about neurology than all these other branches.
That's really nice to know. So let's understand now about a bit about the sub branches of neurology. What are the kind, if somebody picks up neurology, understanding where to practice, but then there are sub branches also where currently in this scenario people want to get more specialized and creating their niche. What are the kind of sub branches are there present in neurology?
So there are many. I would say neurology is one super specialty where there are a lot of subspecialties. So the 3 most common ones are movement disorder, stroke and neurointervention, and epilepsy. So these are the 3 most common ones, while the uncommon ones, which people don't know about, is cognitive and behavior neurology, neuromuscular neurology, then inflammatory like autoimmune encephalitis and all those things. So inflammatory part of neurology is altogether different. So I would say there are 6 to 7 subspecialties. So stroke and neurovascular intervention, epilepsy, movement disorder, cognitive and behavior neurology, inflammatory diseases, and neuromuscular. So these are the 6 subspecialties even if you consider it grossly. So yeah.
So what do you if somebody is already pursuing neurology, what will you suggest that person to pursue among all of these 6?
So it a lot of time depends upon your interest. How do you want it? For example, somebody who is not an emergency person should not pick up stroke and neurovascular intervention. It's like in 24/7 thing. You'll have to be on your toes. If the patient of stroke comes to hospital, you have to rush and then treat, even if it is 2 a.m. in the morning or maybe 12 p.m. in the afternoon. So you have to be on your toes. And that's the thrill about it. But if somebody does, there are people who take neurology because it's a cool branch. You do an OPD practice, you earn decent, you don't want to hectic life, night calls, emergencies. So for those people who have taken neurology because of this, they should not pick stroke and neurovascular intervention. There are other branches like epilepsy, movement disorders, which have lesser emergencies. I'll not say altogether zero, but they have lesser emergencies. And so it depends upon your interests. Like movement disorder, if somebody is more interested in movement disorder, it most of the time when you are doing a residency in neurology, you kind of know what interests you more. And it was for me, when I was doing I'm sorry. Yeah. So for me, it was when I was doing my training in neurology and I was posted in ICU, I realized that I like stroke the most. Right. And I didn't like too much of epilepsy thing. So I decided that I'll probably go for stroke and neurovascular intervention. So that's how I decided about it. But there are people who have been doing it in cognitive and behavior. It's just about the thing that excites you, because I always tell people, when you are a doctor, you are married to your branch. Right. So if you don't like it, even if you get into it, there's no time when you cannot get out of it. It's never too late. So I decided, when I was doing DM, I decided I might go to, because at that point of time, neurovascular intervention was not available that frequently. There was gray zone. So I decided about movement disorders. But then when I was like applying for movement disorder fellowships and things, I realized like I really don't like it. So I chose to like stay away from it and went ahead with the stroke and neurovascular intervention. So it's kind of a dynamics that you have in your head. The thing that excites you, your responsibilities, your personality also makes it a big thing.
Correct. That's so correctly said. So now also we wanted to understand what are the best places to pursue these kind of subspecialties.
So yeah, so in India as well as abroad, there are many. So movement disorder. I'm extremely sorry for these interruptions. I'm extremely sorry.
Yes.
So in India as well as abroad, there are many. So as far as stroke and neurovascular intervention are concerned, so most of the people who have done it, so the fellowships are available. They can be for a year, for
Yes.
2 years. They
Yes.
can be short observerships as well.
Yes.
And it depends whether you want to do a full-fledged observership. And so for that, you have to have places where your license is recognized. For example, Indian medical license is recognized at that place. So Canada is one.
Hmm.
I'm sorry.
It's
I
okay,
should
Dr.
give
I
me.
completely agree. This happens. That's
Yeah.
completely fine. We are enjoying your discussion. That's completely
Yeah. So what happens is that if you like, Canada is one preferred destination for epilepsy, stroke, neurovascular intervention, as well as for movement disorders. US is one, but you have to appear for MLE if you want to have a fellowship there. Then some people decide to go to Australia, which is a very competitive place to go. UK is one, but again, very competitive, and you have to give PLAB or MRCP to get registered. In India also, earlier there were not many opportunities for fellowships because there were not many applicants, because neurology as a super specialty was considered to be an end branch. But now in institutes like NIMHANS, Sri Chitra Institute, AIMS, and even some private institutes, they have been offering great number of fellowships in many specialities. The way to go about it is you decide, you attend conferences, you meet people, you read papers, you write mails to the foreign universities, the people you meet in conferences, and then you talk to your seniors and know about the branch, and then apply to these institutions. Most of the institutions have their forms in April.
Okay.
So you can look forward like around November, December, that their forms will be out. If you want to go abroad, it at least takes you an year or two, because they have interviews 2 years in advance. For example, if you want to go to Canada in 25, you have to be selected in 2023. So that's how competitive it is. You have to be very early in your career before you decide, okay, like, okay, I want to do a fellowship. It's not that you decide it now and then you go after 6 months. It takes a lot of time, sometimes 6 months, sometimes a year or two. So you have to be prepared for that. And the best thing is attend conferences, meet people, and that will also make you understand whether you like that specialty or not. And that will also make you understand how to pursue, how to go forward about it. For those who really want to know how to go forward for these fellowships and for these positions, they can ping me separately as well, and we can have a workshop all together, and you might be having questions on your Facebook live video, and that we can attend to.
Definitely, that we can always look forward to, sir. So yes, so also we have Dr. Jasmine who is actually asking a question from you. She's asking the scope and options for neuroimmunology in India.
Hi, Jasmine. So Jasmine have been asking me this question, and like, unfortunately, we haven't been able to talk. To answer Jasmine's question, neuroimmunology, I was talking about inflammatory diseases,
yes,
has it's now the new thing, a new kid on the block. So almost 5 to 7 years back, they other than some inflammatory diseases like multiple sclerosis, which is not that common in India, there were very less number of diseases that had in neuroimmunology. Now there are autoimmune encephalitis and like whole lot of the gamut that you have. So neuroimmunology at present is available in Sri Chitra. Neuroimmunology is present available in NIMHANS. And then there are individual consultants that offer you this. It's more widely available in abroad, and it's relatively easy to get into neuroimmunology fellowships abroad, because they are less competitive. Epilepsy, movement disorder, and stroke are the most competitive ones. Cognitive behavior, neuroimmunology are less competitive. So it's relatively easy to get into these fellowships. As far as the scope of practice of neuroimmunology is concerned, it's great, but it depends upon where you want to practice. For example, if you want to practice in a metro, you can choose this subspecialty and then you can practice it, because you'll have a lot of patients. And then because there's been subcompartmentalization of neurology as a specialty, If you sit in a big institutes, you'll have your share of patients, and that will keep you busy, occupied, and interested in your work. When talking about tier 2 and 3 cities, it's not that lucrative an option to practice neuroimmunology at present. But when we talk about a decade later, maybe that's the future. So when I talk about neurology, I talk about 2 or 3 branches. One is stroke and neurovascular intervention. 2 is neuroimmunology. And the third one is movement disorder. So these 3 are the future of neurology, if you consider. So it's the best bet to practice neuroimmunology at present, which also involves neuroinfections at times.
Okay. So this is really nice to know. And I hope, Dr. Jasmine, you have got your answer to your question. So we have one more question by Dr. Debashish. He's asking that what is the scope in neurointervention fellowship in India?
So when I was doing it, there were only fellowships available, which were not recognized. Now there is courses by FNB. So the national board conducts regular examinations every year. There are 5 seats at present at multiple places, one of which is in Udaipur, one of is in Breach Candy, one is in Narayana Hospital, Bangalore, one of which is in KEM, Pune. Then there are other fellowship positions available which are not accredited by DNB or FNB board, but they hire for. So these fellowships I'm talking about are for 2 years. And these have an entrance exam, which include questions from stroke, as well as neuroradiology, as well as a part of neurosurgery. So all of neurointervention combined, because neurointervention is a gray zone which involves a bit of radiology, a bit of neurology, and a bit of neurosurgery. So the entrance exam involves questions from all these subspecialties, and they have it every year around April to July. So this time it got delayed because of COVID, and the recent fellows have joined only a month back. Otherwise, they usually join in July. And April is the time when the fellowship exams happen. So the right way to go forward about it is to read and to apply for these fellowships. Then if you don't want a formal fellowship because there are less positions, there are many applicants, if you don't get into it, then there are fellowships available which are non-accredited, but they are of equal value. For example, I was in Medanta. Medanta offers a fellowship in neurovascular intervention, which is like, I'll rate it as the best fellowship position in India, and one of the best is in Asia. But it is not FNB accredited, but it's there, and like you have to apply to the consultant. The position in Medanta is under advertisement at present. That's for Devashish. He can apply right now. 15th March is the last date for the application. So you have to be either a DM in neurology or an MCH in neurosurgery or a DM in neuroradiology to apply for these fellowships. And if you get selected, you slog it out for 2 years, and then you are out practicing neurovascular intervention.
Correct. This is such a nice explanation, sir, to understand. I hope, Dr. Debashish, this explanation helped you in understanding about neurointervention. Also, we want to understand, because you have gone internationally to understand about stroke as well as neurovascular intervention. How was your experience there, and how will do you suggest other people also to go and to opt for that?
Yeah, so there's a lot of difference. So when I was doing neurology, the stroke was considered a disability. Like it was kind like if the patient reaches us early in the window period, you thrombolize, but otherwise there was nothing more to it. When I went abroad, my understanding about stroke improved. So stroke patients as such have a different level of care that they need. The concept of stroke units, which is now evolving in India very fast, which was there abroad when I went on Australia or even in Austria, where I have been to. So the concept was completely different. The way they approach patients, especially with regard in stroke and in other subspecialties also, is very different. The institutes in India, some of them have the same level of excellence, but not all. But it's always better to go abroad and give it a chance to know about the cultural differences, to know about how is their approach different. At times when you come back, you might not be able to apply everything that you learned there to our setup, which is a resource limited setup. But going abroad definitely makes you understand better the scope and the whole branch in a way that pushes you to go further. So even if you go for a two-week or 2-month observership, it will give you a glimpse of what the branch holds.
Correct, correct, correct. That's so true. So we have one more question by Dr. Jasmine. She's asking, other than Canada, which countries recognize Indian DM degrees?
Unfortunately, not many. I'm sorry, Jasmine, but it's very easy to pass PLAB. So, and then the good thing about the other countries, I'm not talking about US. So if you talk to these consultants, you meet them in conferences and you talk to them, and then they kind of peek around the system to get into their fellowship position. So you might not be joining as a clinical fellow, because for that you need license, but to join as a research fellow, you don't need a license. Sometimes even being a research fellow, you are doing the same thing. It's just that your name is different. So if the consultant likes your CV, if you have been in touch with him or her at an international level, you can get into it. But other than Canada, I don't think many countries recognize a degree. Australia and New Zealand are two, in which you can get a fellowship without appearing for any exam. UK is one in which they like kind of tweak the law to invite you, and even clearing PLAB is easy. So I would recommend either to go to UK, Scotland, or Australia or Canada. So these three are the best places if you want to pursue neuroimmunology as in subspecialty. And if you have good contacts, you don't need to need any other license in all these countries. For UK, you might need to sit for PLAB, which is a basic requirement, which is not difficult at all. I've cleared PLAB, and like I know Jasmine can clear it in 2 months' time.
Okay, great. So Dr. Devashish also has one more question. He's asking, does neurointervention fellowship includes transcranial Doppler skill?
Yes, it does. So depends upon which is the place where you're doing it. So I did it in like Medanta, and we were doing it TCD, and there were places where they do it and a lot more, and there are places in where we don't do it as frequently. So depends upon where you are, but it is very much a part of the curriculum.
Okay. So there is one more question by Dr. Krish. He's asking, are there any post MBBS neurology courses or diploma available now, sir?
Post MBBS?
Yes.
So there are direct neurology and neurosurgery subspecialties available. So you can appear for them. For example, AIIMS and NIMHANS offers a direct 5-year comprehensive course in neurology. So you can apply for that. As after MBBS, you can join as a research fellow. For example, I would love to have a research fellow with me who is working with me. So there are many people who need research fellows under them. AIIMS has many requirements of research fellows. NIMHANS has, like all these big institutes have requirements of research fellows. They might not be given that clinical exposure, but yes, you can do whatever you want to. Being in that research setting, and that also makes you understand the branch better. So there are a lot of opportunities, depends upon how do you want to go about it. It's just about your patience, your skill, and as I always call it, jugaad in India.
Yes, that's true. So one more question by Dr. Devashish about the neurointervention fellowship. So he's asking, scope for neurointervention outside, is it scholarship or full course fee?
Outside, you don't need to pay a fee. So outside, you are getting paid. If you want to go outside for neurovascular intervention fellowship and you are selected for that, you'll be paid for that. You will not be asked money for that. But to get selected is a very competitive thing. For example, to go to Canada, it takes around a 3-year thing. So for example, you apply now, you probably would be listed for a batch, which is 3 years or 2 years later. So it's difficult to get into. For observerships, you have to pay for your stay and your expenditure of living there. And most of the institutes don't charge anything. Singapore is one where like they charge you for even for observerships. But most of the Western countries, they don't charge you anything for the observership, but you'll have to manage your stay and like all those things.
Okay. Okay. Great. Great. Nice to know. I hope this solves your question, Dr. Debashish. So, Dr. Abhishek Chaudhary is asking, can we learn Botox without doing movement disorder fellowship?
Yes, I haven't done movement disorder fellowships. I inject Botox very frequently. So depends upon where you are getting training from. For example, I did it from IBHAS. We were having free hands in injecting Botox. We were injecting it. So I am thankful to my mentor, Dr. Suman Kushwaha, for this. So she gave us all the opportunities to inject Botox to our patients. Even if you are doing it AIMS, I know Dr. Vinay Goyal, like he gives ample hands-on. Like even Pant, that is Dr. Sanjay Pandey, gives you ample hands-on. So you don't need to do a movement disorder fellowship to learn how to inject Botox. You can learn how to inject Botox in your residency. If you're not perfect in it, you can stay around the movement disorder person who's there in your hospital and see how he's giving, and then attend these workshops that are conducted by many companies professionally, and then you learn it. So it's not rocket science. So you can do it.
Great, great. So I hope, Dr. Abhishek, it solves your query. Anything else, please let us know. So understanding about the fellowships and the sub branches in depth after neurology is great. So now anything from, let's end this on a high note. Any motivational quote from your end for the medical students who want to pursue neurology, or students who are into neurology, to motivate them to do better, and as you are doing?
So neurology is not a dead branch. It's the go-to branch for next decade. I'll say for the next decade is of neurology. When we talk about neurology, the subspecialties, especially stroke and neurointervention, because I'm a neurointerventionist, I'm a fan of it. So mechanical thrombectomy as a treatment for stroke is one treatment which has a number needed to treat of 2, which is one of the best treatment has ever been discovered by science. Even for PCI, which is routinely done, like coronary stenting, it has a number needed to treat of around 18, which is like far away from a number needed to treat of 2. So neurology is no more a dead branch. It's the go-to branch. It's one of the upcoming branches. You'll have a lot of scope. The work-life balance is amazing. And the money is also not bad. And so it's just that you should have it enough in you, and the patience should be there, and the sky is the limit for you. So there's no upper limit to it. So just go for it. Neurology rocks.
Yes. Thank you so much, Dr. Vinit. And actually, trust me, I have been knowing Dr. Vinit for a pretty long time now, and he's doing an amazing work. The other day only he shared a case with me, and it's fantastic. So trust me, if you pick up neurology, it's an amazing branch to go forward currently, because the scope and the advances coming up in neurology is really making it a branch to look forward to. And actually, Dr. Jasmine is mentioning, thank you once again to Dr. Vinit for all the motivation and guidance. And I'm sure it must have been helpful to lots of students out there who are listening to you. And please do share it with your friends and colleagues. I'm sure it will be helpful for them also to understand about neurology, and also for them who are into neurology, what kind of subspecialties they can go for and how they can proceed in that. In case of any confusion, you can definitely reach out to us. Dr. Vinit is there to help each one of you in case of any problems related to neurology. Thank you so much, Dr. Vinit, for joining us at this time to guide us about neurology in such a fantastic way.
Thank you so much for having me. It's always a pleasure to help young minds. Yes. And I hope it settles down their confusion, which unfortunately I could not had a solution to when I was young and doing neurology.
Correct. I'm sure your guidance will help so many out there. Please do, I'm again repeating, please do share as much as possible. Also do follow us on our YouTube and Instagram channel. There you can find all our old videos, which can also help you in your career growth. Thank you so much everyone for joining us at this time in this interesting discussion. Thank you so much, Dr. Vinit. Have a good night and a good sleep. Bye-bye, everyone.
Thank you. Good night. Bye-bye.